And good morning, everyone. I'm Ariane Bureau here at the Digital Desk. And October is Breast Cancer Awareness Month, and we are continuing our conversation around this topic. So today I'm joined by Jean Dore. She is a registered nurse at Providence Imaging Center. She, along with others, she plays a crucial role in supporting women who've been just diagnosed with breast cancer. I want to bring her in. Jean, good morning, and thank you so much for taking the time to chat with us today.
Well, thank you. It's a pleasure to be here.
Well, first, let's just get right into it. Tell us a little bit about your role in supporting these women after they have just been diagnosed with breast cancer.
Well, first, I have to correct you. I actually meet women even before they have been diagnosed. Um, Women come to the imaging center either for a screening mammogram or because they have a finding that they're worried about, and we do the imaging that gives them the answer. As soon as a woman finds out that she needs a biopsy, she will meet with me and I will tell her what this biopsy means. And of course, women are always afraid. Um, this could be a cancer. And so we talk with them about their fears. We give them answers. We tell them what we're looking for. And then I follow them through the process of their biopsy and call them after it's been done to make sure they're healing without any problems and to make sure they got their result. Most women hear that they have a cancer through their doctor, but because of some legislation that has come out recently in the last few years, people are getting the results directly on my chart, which means most of the time they're seeing the result in their home on their computer even before their doctor knows about it. And so a lot of these women will call their doctors and find out what their result is, but many of them can reach me easier. And so I sometimes am the first voice that they hear in their um, fear and anxiety of that they have a breast cancer. And I answer whatever questions I can. I tell them what's coming next and help get them set up with navigators. I am not a nurse navigator, but I do the first part of this breast cancer journey with women. And once they know they have a breast cancer, I then follow them until they're connected with a team. Most of the time, the breast surgeon is the captain of that team, and they will pull in the other providers who are needed to give that uh, treatment or treatment plan to the patient. And once I know that they have a team of people there, and I do connect them with a nurse navigator at the cancer center, um, then I pretty much my journey with them ends, except that they still have my name. And during their cancer treatments, if they're coming into the imaging center for more imaging, I do sometimes catch up with them or see how they're doing because I was the first face they saw when they found out they had breast cancer.
I mean, that's a pretty crucial role that you have, and I know you don't take that lightly, Jean. What are kind of some of those common questions and those common concerns that women have initially off the bat when they are just getting that diagnosis?
What's next? It's always the first question. What's next? And and they feel out of control. And so I try to tell them what to expect and what they can do. And things do move fast after a woman has been diagnosed with breast cancer. Almost every one of the breast surgeons in town keeps appointments open in the week for brand new diagnosed breast cancers. So the wait is not very long until they see a specialist and get an explanation of what kind of cancer they have and what can they expect for treatment. And I love the example of saying to a patient when they go see the breast specialist, she's putting all the pieces of the puzzle together. We did the imaging. They will do a physical assessment. They'll look at the imaging we did. They will look at the pathology that pathology did. And then they will look at the patient's family history and personal history, put all those pieces together to make sure that their cancer treatment is going to be individualized for them. Um, and they'll give them more answers. And then the nurse navigators at the cancer center kind of surround them with the support they need. So nobody has to reinvent the wheel on um, where do I get a dietitian consult? Where can I get financial counselors? What if I lose my hair? Where do I get a wig? We don't want women worrying about the little things that we already have answers to. And so the nurse navigation, or actually it's social workers in the navigation center who will help them with resources, how to travel, where to stay, is there funding, all those kinds of things happen. But letting a woman know in the beginning, these things are taken care of. You are going to be surrounded by people who will help you through this. That makes a huge difference.
And Jean, you had mentioned, this is kind of that first initial time where the women and their families, their support team are really kind of anxious. What do you say to them and how do you kind of navigate through that hurdle?
Well, I like to get things set up right in the beginning. So when I'm sitting with them and they know they need a biopsy and that it could be a cancer, a lot of women are sitting with me alone. And I say, do you have a family member you want to call to hear me talk about this with you? So that there's another set of ears and maybe they're going to think about what I say in a different way and ask more questions. So sometimes the woman I'm sitting with wants it just to be her and I. Sometimes they do want me to be on the phone with a family member. And so I start that discussion early, long before they hear the word cancer. Yes, it's been confirmed, so that they have something that they can discuss. They know their fears, and that's a huge critical point. But it's usually up to the woman who she wants involved and how much she wants involved. And then when they call me because they got their result, that call is usually on the phone. Um, but I will conference call with anybody they want me to conference call with. So I include any family member or significant other in that call at the time that we talk about the cancer. And I'm sure doctors' offices do that the same. Um, like I said, most of the time it's the doctor who gives the patient the result. But if for any reason they saw it on my chart and they can get a hold of me, but they can't get a hold of their doctor, that's how I treat the call that they give to me.
And Jean, how important is it for your patients and their families to feel connected to their care team? I know you mentioned that you kind of go through the questions, and if they're nervous, you help answer and navigate. But having that connection, if they don't feel comfortable at first, how do you guys go about that?
Well, a lot of that comes after they see us, but um, that's part of the question before they're even connected with a surgeon. And I tell women, your primary care provider knows you better than I do. I've met you once, you've come for imaging here. I trust your provider to pick the breast surgeon who's going to fit best with your personality type and give you what you need, because all of our surgeons are excellent. I've had personal friends who have seen each one of these different specialists and they wouldn't want to go to anyone else. So I know the talent that we have here in Alaska is great. And really, what it comes down to is personality and where do they feel comfortable. So I don't really give a recommendation on who somebody should see, but I do recommend that they turn back to their provider who knows them. And then that also helps women feel a little bit more supported because their primary physician is in on that uh, referral process, and the patient gets to meet with the surgeon. And so I guess I'm the person who sets up all the expectations and what to expect, and so that it decreases the anxiety level so that when it happens, it's not unfamiliar.
Yeah, no, some good advice there. So when we know folks or women, when they get that breast cancer diagnosis, that can certainly be a scary time, and they have their support team, they have folks like you. What would you say to people who are like maybe their friends or their coworkers that they're just finding out? How do they help kind of navigate? What questions can they ask? How can they show up as a support without maybe kind of feeling like that awkward and I don't want to ask questions?
Well, starting out simple and just saying to somebody, I'm sorry. Oh, this has got to be a stressful time for you. Is there something I can do that will help you? because none of us can anticipate what each individual person needs at any one time. And so just asking them straight out, what can I do that will help you now?
Some great advice there. And Jean, before we go, is there anything else that you want to mention or add? You know, of course, we talk about Breast Cancer Awareness Month for October. This certainly is a conversation that will always continuously happening, but you're in the thick of it. You see it day in and day out. So I will let you have the final word and kind of any final thoughts regarding someone just being diagnosed and then the connection and the care that goes beyond that.
I guess because it's such an emotional topic, I would say, please, ladies, get your mammogram. The amount of radiation that is given during a mammogram is about the same as jumping on a plane and flying from Alaska to Washington State. And we don't think twice about doing that. But getting a mammogram can save your life. And it's the one study. A mammogram will find cancer in its earliest form. If you are getting regular mammograms, we have the potential to find it in its earliest form when its treatment is the very easiest. So please don't skip your mammograms. It's worth the radiation that you get from that study. We know it's a risk, but the benefit is so great. And being able to treat you early is great. So don't skip mammograms. Thank you.
On Alaska's News Source. I'm sorry, Jean, my mic was down. Can you hear me now? Okay, I wanted to say
Yes, I
thank
can.
you. I wanted to say thank you for taking the time to chat with us. We appreciate your time.
You're welcome. Thank you.
And thank you all for watching another live stream here in Depth Alaska. Of course, you can find updates on our website, alaskasnewssource.com. Breast Cancer Awareness Month, we're continuing that conversation. Thanks for tuning in.